everyone. My name is Elise Guest, and I'm the Planning Coordinator here at CASN, and I'd like to welcome you to the first of 3 Infoway-sponsored webinars being presented by CASN on a variety of topics connected to informatics and nursing education. Today's session, entitled Empowering Patients in a Digitally Connected Health System, Implications for Nursing Education and Practice, is being presented by Dr. Minal of the University of Alberta and Professor Jody Found of Saskatchewan Polytechnic. Dr. Klebe is the founder of the Nursing Informatics Association of Alberta and has worked on several CASN Canada Health Infoway digital health projects geared at advancing nursing informatics and digital health in Canada. Professor Found is the Education Chair and Secretary for the Saskatchewan Nursing Informatics Association and the Director of Education for the Canadian Nursing Informatics Association. She is involved in various national projects to advance technology usage in nursing and healthcare. Following today's presentation, we will have time for questions, but please feel free to submit them throughout the presentation. To submit a question for Dr. Klebe and Professor Found, please use the Q&A function on your screen. Once you have finished typing your question, please don't forget to hit send so I can read it. I'll now turn the session over to Dr. Klebe and Professor Found so we can begin. Dr. Klebe?
Thank you, Elise, and thank you all for attending this webinar focused on patient empowerment in the context of digital health. So in this webinar, Jody and I are hoping to increase knowledge and understanding of digital health and nursing informatics competencies as they relate to patients and their health. So in the next hour, we'll take you through a few tools that could be used to assist patients and their families make better use of digital health resources. We'll focus on one example of how patients can use health information online and how they can make informed decisions about what resources to use. We're also going to talk about some informatics resources that nurses and nurse educators could use to support integration of informatics competencies and consumer health and nursing education and practice. As Elise mentioned at the end, we'll have some time for discussion and question and answer, and as well we will be talking in relation to implications for nursing practice and education. So evidently the landscape of healthcare is changing and we're moving towards a more connected model of health management. This is in a large part is enabled by the power of information and communication technologies and the digital health tools that are evolving on a daily basis. Such tools are enabling sharing of pertinent health information between providers and recipients of care, as well as facilitating the planning of health services and interventions around the patient's needs, and with their full participation in the process, which is quite important. And there is no doubt that technology has permeated every aspect of modern life, and healthcare is no exception. In a survey of Canadians' utilization of digital health services, results have shown that over 80% of Canadian households have had access to the internet in the year 2012. And in 2014, over 70% of care providers referred their patients to web resources for health information. Moreover, in 2016, of the Canadians that navigated the web, 30% looked for health and medical information. So all these statistics are showing that Canadians are already engaged and they are trying to take advantage of digital tools to manage their health and well-being. So what is digital health? Digital health enables viewing and sharing of health information and enhanced access to services. Give you some examples of these, like things like e-visits, e-prescribing, patient portals, remote patient monitoring, and so many other tools. These tools are contributing to improving the patient experience and their interaction with the system. In this same survey that we have just discussed, of the Canadians that have used the digital health services, 76% indicated that it made navigation of the system easier and more convenient. And over 80% indicated that they will take advantage of these tools if they are made available. Also, digital health tools are contributing to improving the experience of care providers and the quality and safety of services. This is enabled by timely access to pertinent information that is essential for clinicians to make informed decisions. Give you an example here, over 90% of pharmacists that have used the drug information systems reported that the quality of patient care they provided improved by using these systems. Essentially, the goal of digital health is to empower patients through increased participation in the management of their health and wellness. So when patients have access to their health information, they are more likely to be involved in their care, and they are in a better position to make informed decisions about their health and wellness. Also, these tools can be very useful for patients that require frequent access to the health services. For example, patients with chronic illness. Such tools enable them to access and receive care in the comfort of their homes and amongst their families and loved ones. As you can see from this slide, more and more patients are increasingly feeling empowered and satisfied with digital health services in Canada. We'll take a couple of minutes to watch the story of Carolyn sharing her experience using the remote patient monitoring tool. Elise, can you please take us to the video? I can't hear a volume. I hope others can hear something. I'm not able to hear the video. Can you hear me now? Can you check the volume on the YouTube video itself? Sorry for the glitch, guys. We'll fix it in a minute. Elise, I would suggest maybe to stop trying with the video. We can probably share it with the rest of resources for the participants to look at it at a later date.
Minal, I'm getting notes that the participants can hear it.
They can hear it? Can they or they cannot?
Yes, they can.
Okay, okay, perfect. Okay, sorry for this. We hope that you have heard the video, and if not, we will provide it along the list of the references with this presentation. So why this discussion is important to nursing and nursing care? Why should we talk about digital health? And in recent years, you probably have seen how much we're talking about nursing informatics because it actually provides us the tools to be able to utilize technologies in a more effective and efficient way in healthcare. So nursing informatics is the science that links nursing, its information and knowledge, and their management with information and communication technologies to promote the health of people, families, and communities worldwide. It is essential for every nurse practice, and we are trying in Canada to build a lot of capacity in informatics through different means. Now I will stop talking, and I will turn over the slides to my colleague Jody for her remaining section. Thank you.
Thank you, Minal, for providing the definition of nursing informatics and also an overview of the Canadian landscape. Nursing certainly and healthcare are changing rapidly, and it is imperative that nursing knowledge not only keep up, but inform the system along the way. We all want to offer a system of healthcare that not only works well for nursing, but most importantly to improve care and health outcomes for patients. Just a quick note before I proceed, although I often use the term patient in this presentation, please know that I also mean the citizen, the consumer of health, or the client. So my main goal for the rest of the presentation is to provide the how. How can all nurses improve their digital health skills? How can you, a nurse or allied health professional on the call today, use that knowledge and skill to improve the health system, outcomes and experiences for patients, or perhaps your own or your family's health outcome or experience? I'd like to introduce you to the list. So this is the list of nursing informatics entry to practice competencies for registered nurses. This list was established through a task force and a rigorous and informed process that you can refer to in the actual documents, which are posted on the CAUSN website. So CAUSN, for those that may not know, is the Canadian Association of Schools of Nursing. The goal of that task force was to promote a national dialogue among nurse educators, informatics experts, and nursing students on integrating nursing informatics into entry to practice competencies, to increase the capacity of Canadian nurse educators to teach nursing informatics, and lastly, to engage nurses' key stakeholders in developing nursing informatic outcome-based objectives for undergraduate nursing curricula. The first activity of this project was to delineate this list of nursing informatic competencies that all registered nurses should possess upon graduating from an undergraduate nursing program in Canada. So the list has defined three main entry-to-practice nursing informatic competencies, and rather than saying nursing informatics all the time, I will refer to it as NI. So the competencies are under the domains of information and knowledge management, professional and regulatory accountability, and the use of information and communication technologies. An overarching competency has been penned which captures the essence of all three domains, and you can read it on the slide. So competency 1, information and knowledge management. It would require the nurse to use relevant information and knowledge to support the delivery of evidence-informed patient care. So this competency has 7 indicators under it and may include things such as being able to articulate the significance of information standards necessary for interoperable electronic health records across the healthcare system, and also articulate the importance of standardized nursing data to reflect nursing practice, to advance nursing knowledge, and to contribute to the value and understanding of nursing. Additionally, the nurse should be able to analyze, interpret, and document pertinent nursing data and patient data using standardized nursing and other clinical terminologies. These would be terminologies such as the International Classification of Nursing Practice, ICMP, CHOBIC, and SNOMED CT. These would support clinical decision-making and nursing practice improvements. One further example under this competency, which we'll come back to again, is to be able to assist patients and their families to access, review, and evaluate information they retrieve using technology, and also to assist with leveraging ICTs, or information and communication technologies, to manage their health. So these would be things such as social media sites, smartphone applications, and online support groups. All of these combined would provide the information and knowledge management competency. Competency number 2 is professional and regulatory accountability, which encompasses using technologies in accordance with professional and regulatory standards and workplace policies. There are 6 indicators that fall under this competency and include things such as complying with legal and regulatory requirements, ethical standards, and organizational policies and procedures. And for those of you in practice, there still may not be any policies or procedures, and nursing can certainly lead the way. The third competency is information and communication technologies, which comprises using ICTs in the delivery of patient care and has 6 indicators, which include appropriate use of technology, using decision support tools, often at the bedside, supporting the therapeutic relationship while using ICT, and the ability to describe types of electronic health records and their benefits. So to summarize, there are 3 main competencies with 6 to 7 indicators under each competency. And if a nurse achieves the 6 to 7 indicators under each competency, they would be considered competent. So in order to assist faculty to integrate the competencies into the undergraduate curricula, Kazan conducted an environmental scan of nursing informatics resources to develop a nursing informatics inventory of existing teaching and learning resources. Many gaps in resources, however, were evident, and so this toolkit was created to fill these gaps and augment the resources available to teach the competencies. So the Nursing Informatics Teaching Toolkit serves 2 purposes. First, it provides key concepts and key learning, summarizing information faculty should know to teach each competency. And secondly, it provides faculty with teaching tools that can easily integrate into pre-existing lesson plans. For each competency, there is a case study, a PowerPoint presentation, and discussion quiz questions that can be used in the classroom. As Kazan is a national organization of schools of nursing, the Nursing Informatics Teaching Toolkit was designed for use by nursing faculty. Many other individuals, however, may find this toolkit helpful, particularly faculty from other health science disciplines, nursing students, and practicing nurses. In 2015, Kazan established a digital health nursing faculty peer network, of which Minal and I are part of, and it was to assist in the uptake of the competencies. As you can imagine, educators and schools just couldn't wait to add more information to their already full curriculums. The network was led by nursing faculty who have championed digital health and nursing education, in addition to connecting with nursing faculty all over Canada. The peer leaders collaborated with Kazan and Canada Health Infoway to develop a resource focused on consumer health solutions. So consumer health solutions can include information and resources found on the internet, apps, wearables, fitness trackers, virtual patient communities, remote patient monitoring, telehealth, e-visits, patient portals, and personal health records. So this resource is designed to be used by nurse educators to expand their knowledge of digital health and integrate consumer health solutions into their courses. By using the teaching activities outlined in this resource, educators will be able to easily integrate this growing area of informatics into the courses while still reaching the indicators identified in the entry to practice document and the competency list. Nurses working in direct care, policy, or other areas also may find this resource useful to expand their knowledge. Again, this work was undertaken to expand the capacity of nurse educators to teach digital health and to increase the uptake of the competencies in curriculum. So nurses not only need to be part of the change, but lead the change in healthcare. So I would like to come back to competency number 1. So I know you all remember what that one was. And if you were thinking information and knowledge management, you'd be correct. So one of the indicators under this competency is to be able to assist patients and their families to access, review, and evaluate information they retrieve using technology, and also to assist with leveraging ICTs to manage their health. We cannot look at this indicator without considering health and information literacy. According to the Health Agency of Canada 2014, about 60% of all Canadians are not health literate and 88% of seniors. Nurses can have a role to increase patient awareness of available resources and teach Canadians and seniors skills to increase health literacy. One way is to help patients use the Internet to seek information to improve health. As Minal mentioned, we know many Canadians are seeking health information online. I would like you to think about how, as a nurse, can you develop your own, your students', your patients', your community's health literacy? Is there anything you can do to help increase the ability to access information, understand information, and develop a plan to act on various forms of health information coming at us? It may be to advocate for widespread Internet use in our province, especially in rural and remote areas. It may be fundraising for computers for patient access in your local library, church, or healthcare organization. It may be simply sitting with a patient and educating them about their illness, utilizing technology tools. I invite you to write down your ideas, and we can come back to this at the end of the session. Ball 2011 identified the following information literacy skills as essential for all nurses: identifying there's an information need, accessing information relevant to the need, evaluating that information for quality and applicability, and then applying the information to the need. And then, of course, with the nursing process, evaluating those outcomes. So for nurses to develop their competency in information and knowledge management, they must develop these skills in order to provide evidence-based knowledge and information to practice, but also to assist their patients to become more literate. We could simply direct patients to good quality sites, but wouldn't it be much better for them to develop their own informatics skills related to health and information literacy when seeking health information on the Internet? There are certainly many benefits when utilizing technology in healthcare: increased patient safety, work efficiency, improved patient outcomes, to name a few. I'll not be covering these today, but the literature is full of examples. There can also be challenges and risks that nurses need to be aware of. Nurses must be vigilant with patient information. There are many best practices to minimize the risk. This would be developing your competency number 2. And I know you all remember what that was: the professional and regulatory accountability piece. So the Office of the Privacy Commissioner has many resources for your reference, but could include practices such as using strong passwords, encryption, not having patient personal information on personal devices, and many other best practices. Nurses must also consider not only the divide across generations when it comes to the digital divide, but also the geographical one, especially in Canada. We must continue to advocate for access to Internet, especially for those in remote and rural areas. So what about information overload? You just need to Google one health-related term. You'll likely get millions of hits. This can leave patients and nurses overwhelmed and wondering where to go for the best information. Developing competence in informatics can provide nurses and patients with skills and resources to seek out good information, and more on this in a minute. And then we've already touched on health literacy. So there's certainly a risk that not all information on the World Wide Web is going to be good information, and nurses are in a good position to assist patients to increase their health literacy using the Internet. So how then can you utilize the toolkits for your own competency, or how can you use the resources available to easily integrate informatic competencies into your own curriculum? We will delve more deeply into achieving Indicator 1.3 under Competency 1, and I know you all remember Competency 1. So I'll guide you through the steps. Some of you on the call may already be expert in this area, but it's simply being used as an example to provide you some insight how you can utilize the resources available. So I want you to first consider your rationale. Why would a nurse want to assist patients and their families to access, review, and evaluate information they retrieve on the Internet, and also with leveraging ICTs to manage their health? We do have a question and answer area, and I invite you to put your list there. So again, why would a nurse want to assist a patient and their family to access, review, and evaluate health information they retrieve on the Internet, or assist them with leveraging or using technology to support their health? So for instance, you may want your patients to get the best information about their search topic. You may want them to access good support groups, one that is not an advertising site for quackery, etc. Technologies can be beneficial. CaringBridge, for instance, is a portal that families can use to stay connected with patients who have cancer. The District of Peel in Ontario is supporting new mothers with a Facebook page, and health apps are monitoring our own vital signs, blood sugar, etc. So this is an excerpt from the actual Consumer Health Toolkit. I wanted to show you how easy it is to integrate the lesson into your nursing curriculum. Notably, many of the activities achieve more than one indicator under one competency. So you recall there were 3 main competencies. So the learning activity for this example is the evaluation of a website. And it gives a description of the activity. The plan also suggests the program year for teaching undergraduate nursing students. In this example, it would be year 3-4. The plan also suggests the key concepts and the learning outcomes. For an educator, you basically select the lesson plan and follow along. We've tried to make it very easy to incorporate the competencies into any nursing curriculum. The next slides complete the lesson plan and likely has the most beneficial information, the resources. And the indicators. So this one covers several indicators in all 3 competencies, as you can see listed there. So as Minal alluded to earlier, many Canadians are seeking health information on the internet. So how is it that a nurse can empower a student nurse or patient with skills in evaluation of a website? So in an effort to promote the quality and reliability of health information posted on the internet, the Health on the Net, or HON Foundation, developed a code of ethics for the certification of health-related websites. And this is simply one tool that we've suggested here. There are other tools as well that could be utilized for this, but the main thing is that it provides pause for the patient and the nurse to sit down together to describe some indicators of what would be important. So things such as the authors, what are their credentials, what is the URL, is it a government site, an education site, or a commercial site? What about privacy? Does the website request personal information from you? What about the quality and the content? And nurses are in a good position to evaluate this. And financial support. Who funds the site? Is there a conflict of interest? What kind of advertising is on the site? So this is one example of increasing our knowledge in technology tools to help consumers. There are various other examples in the CASA materials. So today we just wanted to provide an overview of the resource to your avail and how to utilize them in your current practice. We also wanted to demonstrate one example so you can picture how you might utilize this with students. I have used this in a post-conference following a clinical day with students on the postpartum unit. Their patients are all over the internet looking up information. How can the students help guide these patients to develop their skills and be sure their patients are getting the best information? So empowering patients can take different forms. Nurses who are competent in assisting patients, clients in using information and communication technologies and managing their health can support patients to become more empowered with that information. We focus today on helping patients to develop skills in evaluating web resources as one example. Assessing health literacy. There are a variety of well-validated instruments available for assessing patient health literacy. The Public Health Agency of Canada has several resources available. I would refer you to that for more information. But nurses can certainly improve the health and information literacy skills of patients as discussed earlier. Evaluating websites we've discussed, and virtual communities. There are many online communities being established, and many of these communities provide good health information, and some may not. There's certainly some education that can go along with a recommendation to a virtual community for our patients. The online support groups can be life-changing for some patients, helps them feel connected and like they're not alone. Patient portals are another example. Many jurisdictions are initiating or already have patient portals that patients can access their health records to up-to-date information, connect with healthcare provider, and access their own health information. Nurses can collaborate with these patients to use this technology to support ongoing health and wellness. Knowledge of their results gives the power back to the patient. So this webinar was designed to help all nurses to expand their knowledge in digital health and to help integrate consumer health solutions into your courses and or practice. There are a plethora of teaching activities outlined in the CAUSEN Canada Health Infoway resources, allowing educators to be able to easily integrate informatics. Nurses working in direct care, policy, or other areas may also find the resources useful to expand their own or staff's knowledge in informatics. I would like to encourage each of you on the call to review the resources and consider how you can incorporate some of the skills in your own nursing practice, and if you're an educator, incorporating the competencies into your school's curriculum. You can also utilize the peer mentors. They are listed on the CAUSEN website along with the 3 main resources. Nursing is one of the most trusted and respected professions who are with the patient across the care continuum 24/7 and will need these 21st century skills to take healthcare into a future that values nursing and nursing work. This can only be demonstrated by having standardized terminologies that all nurses use to collect and share data across the care continuum. Patients rely on us to advocate for them and teach them about their own health and how to improve their health outcome and experience. Technology tools can certainly help make a difference. Before opening the floor to discussion or questions, Minal and I would like to thank you both. Would both like to thank CAUSEN and Canada Health Infoway for their ongoing support of this project that started several years ago to expand the capacity of nurse educators to teach digital health. We would also like to acknowledge and thank all the contributors and peer leaders across the country, as all of these resources are the result of their dedicated work. So please find attached the list of references used for the presentation. We'd be happy to send the reference list out if attendees would like. So that, again, the 3 main resources referred to can be located on the CAUSEN website. That's the competency list and the 2 accompanying toolkits. So with the time remaining, Minal and I are happy to entertain questions or comments.
Great. Thank you very much, Dr. Klebe and Professor Found. I'd like to apologize to everyone for the technical issues we had with playing that video on YouTube. I'll be sure to send around the link to everyone so you're able to view that at your leisure following today's presentation. We've had some great questions and comments throughout the presentation that I'm happy to pass along to Minal and Jody. If there are any additional questions out there, please feel free to continue to submit them. Just be sure that you hit submit so that I can read them and pass them along for you. So the first comment that we got was from Elizabeth, who said that nurses must encourage the patient to discuss the information they found on their own with their healthcare provider and tell them which they are using. Minal or Jody, do you have any comments about that?
Sure. I think that this is a great point, and that's really the main discussion today, is to think about how nurses could help their patients make use of this health information available online. And as Jody mentioned, technology provides a lot of resources to patients. Some of them are good and some of them are not good. So our role to help patients identify which are the good resources to use to be able to make those decisions. And when patients are comfortable to share this information with their providers, then there is the opportunity for the provider to jump in and help the patient decide if this is a good source of information or not. So I think this is something that is going to happen, like it or not, because our consumers or our patients are becoming more informed every day about healthcare. Jody, did you want to add anything?
No, thank you, Minal. Thank you, Elizabeth, for the comment.
We had another comment from Natalie who said that health professionals are responsible to ensure they offer information clearly to all their patients, and more than 60% of them struggle with health literacy.
Mm-hmm. Yes, so an ongoing challenge, which I think I've alluded to, and one of the reasons that we're really trying to make sure that all nurses, not just nurse informaticians or specialists in the area, become competent in using nursing informatics and using it with their patients.
Yeah, and also in the presentation, Jody, you have mentioned that there are a number of resources that nurses could use to help patients assess their level of health literacy. So when we at least know and discuss with patients about their level of health literacy, we can then provide them with resources to improve their health literacy. And there are tons of resources out there, that are suitable for different age groups. And I think it's quite urgent because, as you mentioned, over 60% are seniors that are struggling with health literacy. If I'm not mistaken, right? Was it 80 or 60%?
Yeah, it was 88% of our seniors are not health literate, which is really astounding.
It is indeed.
So there was a bit of a, oddly coincidental, there's kind of a follow-up question to that submitted by Yasmin. How can I get my students to understand that their comfort level with technology may be greater than their patients? And what can I do to help them to take that into account during interactions?
Good point. I think, the assumption out there is that our younger nurses probably, or the millennial, tend to be more comfortable with the technology, and definitely they use it, for different purposes, either for learning or, social reasons. And that might create a little bit of a gap, especially if they're using these technologies within the context of patient-provider interaction. But I think also those young nurses are still requiring more focused understanding of information technology, because these are only tools to help us access the information. They are not really the tools to think on our behalf. And here comes the role of the education, where we can help our students see the big value of using the technology, and also remind them of their professional responsibility regarding proper use of technology in the context of patient care. And another important area, not only maintaining the therapeutic and proper relationship and interaction with patients, also the clinical judgment of the nurse, that the technology should never ever take over the nurse's ability to make those decisions. Technology only provides some tools to help you find the information, and then you have to make sense of the information and make the right decisions. Jody, do you have anything to add?
Yes, I would just like to add too that in the example that we provided, we did provide some resources or tools that students can use with the patients. And so whether it's 4 criteria or 11 criteria, depending on what tool you use to evaluate that information that the patient is finding on the internet. So it's a key way that the students can work with the patient in that sense.
Yeah, that's a good point.
Thank you for the question. Anybody else want to chime in? Just remember to hit the enter after you finish your typing so that we can see it.
So Sai has submitted a comment. To fix the problem of health literacy / digital literacy, nursing curriculum needs a dedicated nursing informatics course. However, not many schools have a full NI course. They always say there is no room for nursing informatics.
I think both Minal and I can speak from experience too, what's happened in our schools. And the literature kind of goes back and forth about that, about whether to have a standalone course or whether to integrate nursing informatics across every course. And speaking from Sask Polytech 7 years ago, we did have a standalone course that we developed when we went through our new curriculum, and the students absolutely hated it. They couldn't really figure out how it went together with nursing. And I've found since in the last 5 years, we've now integrated the competencies across all of our courses. And I think my personal experience and from what I've seen in the literature, it's probably the better way to go, because nursing students can then see how it fits with nursing. So my example of using it in a post-conference when students were out in a home with a mother and a father that were using the internet to look up a concern about their infant, and making sure that that patient was utilizing the best resources and best information available to them, and using that tool, the HON code, to lead that discussion. So that's, Minal, do you have anything to add?
I think these are great ideas, and I also want to add that our healthcare system also need to respond to these changes. For example, like you mentioned, students in a post-conference could discuss these things. definitely this is a good area, but also if students don't see enough examples within the clinical practice environment, they will not be able to relate the information and communication technologies to the nurse's practice. So we'd like to see the clinical agencies becoming more receptive to nursing students learning in this area, kind of providing some shadowing experience for the students to work with nurses that utilize patient care technology. We would like to see that students are able to transfer that learning from the academia to the practice setting and for them to really be part of the discussions around information systems and how they are being used within the clinical area. Also some policies, that can guide the use of different information technologies within healthcare practice. Like some students might want to use some health literacy assessment tool that they have pulled off the internet, and they may want to show it to the patient using their iPad. Is this an acceptable practice within healthcare? So this is work in progress, and I think the system is being responsive and is trying to develop these resources and support some policies. But it is kind of, the change is happening, as we speak. So it is something that is now developing at a fast rate, and we need to, as educators, keep abreast of this and also take leadership in making these resources available. If we don't have a question, I have a question to ask to the participants. Just out of interest, I would like to know, if possible, and respondents can probably just, raise a hand or maybe type in, replying in the message section. How many of you have encountered digital health solutions in your practice? And do you see this is really impacting patient care or not? So some of, give you some ideas about those consumer health solutions, something like personal health records, or patients coming in having their own health tracker app that they want to show to their physicians, or patients that bring an iPad with a web page on it that they have accessed online. They wanted to ask the provider about it. So how many of you have encountered similar things in practice?
Rosanna has raised her hand to indicate that she has.
Excellent.
Lynn mentions that she's worked with a web-based family support group, and it was great for accessibility.
Mm-hmm.
Karen's also reporting that she has as well, as has Elizabeth. Anne mentions that she's not seen it in practice, but would like to integrate it into her teaching.
Great. So it is already happening, right? And that's what we have been talking about, that this change is happening as we speak. And, there is a strong movement in Canada to support nursing informatics competencies to help all nurses be able to help their patients and their students become ready to use these technologies in the best way possible.
We have a question here from Lynn. She asks, what is your recommendation on how often nursing students should be exposed to this subject during their bachelor degree? A couple activities each year or 3 hours each year? What do you think is the best approach?
Did you want to go first, or shall I go first, Jody?
Sure, I can give you a break. I haven't seen in the literature where it actually has any hours dedicated. So if you refer to the competency list, I think it depends how you as a school decide to integrate it across. And many of the teaching tool, many of the items in the teaching toolkit do respond to many indicators. So I think there's opportunity almost in every single course to include some type of informatic information. So pharmacology, for instance, what kinds of resources can the students be looking at using their technology to look up information, maybe with a patient, maybe at the point of care. So students aren't really carrying those textbooks anymore, but so every course, I think, has some opportunity, and by utilizing the toolkits, I think you'll get bigger bang for your buck. So we try to consider, activities that would help achieve all the competencies or several competencies or indicators under the competency. So I hope that helps answer your question. Minal, do you have anything to add?
Yeah, I agree with you totally. And I think what we know from research is that really there is no one single approach that would work the best. And most research recommends that there is a systematic approach to integrating and leveling informatics competencies across the 4 years of the nursing program. That seems to be the most effective approach to really realizing capacity in informatics among nurses. Also, as Jody mentioned, like integration in different courses and probably using different ways to provide this learning, like different learning activities, that also seems to be more effective than just doing one standalone course, or one activity every now and then. I think the most important piece here is that we need to show the students the link between these competencies and the nursing practice. I think this is the area that needs much work. So far, we talk about technology in kind of an isolation of the nursing practice. And the technology has expanded in use in recent years vastly. So we cannot really continue to just point at it. We need to actually bring it into the students' life and into their practice roles as they join the practice setting. And this requires, constant discussions, and that does not happen only in one activity or in one teaching course. It has to be threaded throughout different courses, different years of the program, and reinforced as the students graduate and join the work environment and actually take on these roles in their practice.
Sai says, she's got an idea here, I feel that students should have a passport for a few hours every year over the 4 years so that they stay in touch, a little bit like stamps that you get at the carnival for a prize, and that way they're in touch with informatics for all 4 years of the program. And that's what Lynn was thinking as well.
Well, that's a very creative idea. I love it. Mm-hmm. However you can work it into your curriculum.
Speaking of which, DoDEA Minal, can you tell us a little bit about the toolkit? What are your favorite activities or suggestions or ideas within that document?
Well, I teach mostly, I've been out of teaching for a little bit now that I'm a nursing advisor, but I like to use it in clinical with the students, and especially with new mothers is the area where I work. So interestingly, we were in a home and a dad was keeping track on some app of how many minutes exactly the baby was breastfeeding. So it becomes a teachable moment too of when it's appropriate technology or not. So is it really necessary that we need to know that it was 11.5 minutes of breastfeeding on the left side and 12 minutes on the right? And so it was an opportunity to talk to the dad about appropriate technology and, more going by the cues of the baby and the output of the baby. And so I think the student was really thrilled that the dad was using this technology, but then after thinking about it and reflecting about the practice, thought maybe it wasn't the best use of technology. So that's just one example.
And is there a specific activity in the toolkit that you would suggest people check out and consider implementing?
Well, I think all of the activities in the both teaching toolkits for the competencies and for the consumer health resource are laid out in a way that nurses and educators could use them for different situations and also meeting different indicators at the same time. So speaking of the information literacy competencies that we've talked about today, like all of the things related to assessing website, this is kind of really a very important area because of the information access that we have. And, it's easy for each one of us, when you have a question, just to go to Google and go and find an answer. And maybe this is something that, I find all of the resources around health literacy and information literacy really handy and, they make sense and the patients can access them on the web, and they do that and develop their own information literacy as they are learning the competency. And on the other hand, there are some learning activities related to the use of some of the technologies in the delivery of patient care, like, standardized data sets, for example, or standardized nursing languages. In some practice settings, some of those applications are not ready yet, so nurses really don't see such applications to be able to relate to them. So I think that these are helpful to know about, to learn more about, and to try to develop some understanding about, because they are coming at some point when the health system or the healthcare organizations move toward electronic health records. So, are there any other questions?
Yep, we have a question from Elizabeth. The Lung Association has e-modules on several lung health topics, such as spirometry, sorry if I've mispronounced that, work-related asthma, and how do we get the student nurses to be able to access these for knowledge and skill development?
And who provides those resources? Like you say, one healthcare organization. Who is that organization?
She mentions the Lung Association.
The Lung Association?
Yes.
Okay. Yeah, and that's definitely a credible source of information to go for information. Like, if you want to direct patients to find information about their asthma or lung disease, you wouldn't find a better site, than this National Lung Association site. The same with the American Heart or the Canadian Heart Association sites. So all of these provide good resources. And for example, in my classes, when we discuss these things, for example, if we're working with a case scenario involving a patient that has a heart disease, I would make it, an activity within the classroom that the students go and look up information about organizations or resources that the patient could benefit from that are available on the web. And most of them come up with these organizations, on top of the list, and they would find information supporting, the credibility of the site and its potential to inform patients about their health condition. So engaging students about, this in a meaningful way, and asking them to find local and current relevant information to inform their clinical judgment. I think this is one key activity for making this happen.
And getting the... Go ahead. I was just going to suggest, too, that how quickly our textbooks get out of date. And so a student who can zoom around on the Internet and find credible information on the Internet probably has the most up-to-date and best practices versus the textbook that's published several years later.
Mm-hmm. And Rosanna notes that the Canadian... Sorry, go ahead, Minal.
Yeah, I was going to also suggest that there are tons of best practice guidelines. These are useful information and probably is made at a level that a lay person could understand for them, to be able to understand health information related to their health condition. But for students, I think they need to have a broader view of this information, and they can get this by looking up some best practice guidelines. And be more informed about this topic before referring the patient to such resource.
And Rosanna points out the Canadian Diabetes Association is an excellent point of information as well. Sai notes that it's a very good idea to look up on the Internet and get knowledge to help your patients understand their condition. And she follows up that says, even better idea to use it as an evaluative measure in the class.
That's a good point, yeah.
So there's just time for another question or two if there's anything else out there to submit it now. Elizabeth notes that Ontario's RNAO, which is the Registered Nurse Association, has free access to best practice guidelines, I'm assuming on their website.
Yeah. Thanks for pointing that, Elizabeth. Yeah.
Yes, and you can actually download it as an app on your phone. So I've asked all my students to have the app, and they utilize it in the clinical area. So thank you for that.
Yeah.
Great. So once again, thank you to Dr. Kleeb and Professor Found for your presentation and your answering of questions today. And thank you for everyone who participated. Please note that when the meeting window closes, you will be sent to a short evaluation survey regarding today's session. It should take you no more than 5 minutes to complete, and your opinion is greatly valued to us when it comes to planning future sessions. Finally, the recording of today's session will be made available on CASN's YouTube channel in the coming days. And I will be following up later on this afternoon with emails to all participants, including the reference list, the links to the documents referenced here, the CASN Infoway documents, and also the YouTube clip link. And I'd like to thank everyone again, and CASN certainly hopes that you'll consider attending the next session, which will be sometime in fall 2017. Details will be available on that shortly.
Thank you, everyone.
Thank you for spending your hour with us today. I hope you found it helpful.